I'm going to be skipping over slides a bit because I think we're running about 20 minutes or so behind. So I will accelerate a bit, but if you have any questions about those, we can certainly talk. Are the slides going to be available as well for people? No. So you can get the slides, so sometimes I'll flip over stuff, but you'll be able to access them at least. Okay, so this is a little bit different, I guess, here, because I'm not going to be concentrating on digestive health per se. I am going to be sort of introducing you to where we're going with one aspect of our mandate, and that has to do with the healthy eating awareness and education initiatives that we're doing. Notice a lot of you are dietitians, so let me see the dietitians here again. And so a lot of you were at the Dietitians of Canada meeting and probably have already given parts of this to some of you. Is that right? Have I seen some of you before? No. Okay, good. Good. So it's new blood here. That's great. New bacteria, I guess, is really what it was. Okay. So, I see you flipped it into this way. I'm not really going to talk about all those things because we don't have time, but I'm really going to concentrate on our health eating awareness and education activities, which really are sort of three areas: nutrition labeling, sodium reduction, and healthy weights, and where we're going. And really, what I'm really looking for is, we're really looking for ideas about how we can work better with health professionals to take those messages across to that contact point with patients, with consumers as well, to make sure that we're all sort of on message as we go forward. So we'll flip over that. Functional roles. I think a lot of you are aware, of course, is that I've got a policy shop, and they're the ones that, of course, developed the nutrition guidance, the food guide. We've heard a little bit about the food guide already. We've just released the National Healthy. I can't even remember it anyway, the breastfeeding stuff anyway, the feeding for kids from 0 to 6 months. And we've done a lot of other stuff that way. The policy group as well sort of makes that connection of nutrition information into sort of overriding strategic plans like the Curbing Childhood Obesity, the Healthy Living Strategy, and sort of makes sure that we have nutrition front and center in other sorts of strategies that are being developed both at the federal government and across provincial, territorial governments as well. Science provider, of course, we do have a research group there, and we're responsible for surveillance in education. We run the food and nutrition surveillance system for Canada, so that we're the ones that are sort of making that connection through to Stats Canada. So the stuff that I know several people have talked about, our results that we have done the analysis on through the CCHS. Well, I'm going to concentrate has to do with, again, our awareness and education stuff, our health eating objectives. We'll just skip through that. But so where we're going. It's sort of, we came to the realization, and this is not just us working alone, but us working with our provincial and territorial partners, that we're often developing different programs in the different provinces and the territories and ourselves, and that we're not really leveraging the capability to be working together and reinforcing each other, to work on each other's area, use the resources that people are developing in other jurisdictions. So what we did as a group, and we've got a federal, provincial, territorial group on nutrition, and we meet quarterly for sure, but we probably have about another 10 meetings a year as well where we're working on different topics. We decided what we wanted to do is sort of sketch out what would be the priorities in terms of awareness and education about nutrition over the next really 5 years or so. And so this is sort of what we sort of came up with as a group of jurisdictions, that everything's really based on the food guide. Because that is our policy piece. For me, the food guide is a policy document, which also is an information tool to be used when you're talking to people. And then what we are doing then is sort of the first phase of going forward has been about the nutrition labeling. We've been doing that now for about 2 years. I'll talk a little bit about that. We have launched just recently the sodium reduction work just last month. And where we'll be launching sometime in the next spring is really working on healthy weights. And again, this is working together with all the provinces and territories and others, because governments alone are not really going to be able to change the environment enough to make a difference in any of these things. So basically the strategy here is to make sure that we have easy to understand healthy eating messages directed, and our target group here is going to be parents and caregivers. Looking at sort of concentrating on making sure that kids are getting the right type of environment to eat well. It's, again, as I've already said, the idea here is to really make sure that we're leveraging with all sorts of different types of stakeholders. And we're supporting all of that by making sure that we've got a consumer-friendly website and social media activities that's through a whole public relations program. So this sort of says the same type of thing. The main problem here that we see is to cut through the clutter of the nutrition messages. I mean, we get enough clutter just as nutritionists when we go out. When you think of how we've vacillated about certain messages over the number of years, I think we tend to often confuse the consumer, confuse Canadians, rather than help them. And the idea here is, can we actually come up with simple messages, make sure that different jurisdictions, but then also go beyond just jurisdictions and government to, and you see on sort of your left-hand side, in the orange thing, to really work with different intermediaries there. Provinces and territories, the non-governmental organizations, and also we think of Dietitians of Canada and health professionals as being in there too, so that we create these messages and then we have a very focused way in which we deliver them, and we're delivering the same types of messages. As well as the intermediaries, we've got the media partnerships, so working through media to make sure that what you get through the media is consistent with healthy eating messages that are based on good evidence. Industry partnerships. We've been working, and we've got some examples of that as I go forward, making sure that industry, as much as possible, is giving the same types of messages as well, whether it's industry in terms of a food manufacturing industry or whether it's a retailer at point of purchase. And then again, as I mentioned, we'll be supporting it very much with a good public relations strategy and web and digital engagement as well. So the basis, of course, Canada's Food Guide. I don't need to talk about that. We are producing... Canada's Food Guide is a tool that you can use. We're also producing other tools that this Eat Well and Be Active educational toolkit is where we're actually trying to take messages from the Food Guide, combine it with messages from the physical activity guide, and produce activity plans that can be used by all sorts of intermediaries, whether they're in schools, whether they're used by dietitians to groups of people, whether they're really anywhere. Boy Scouts can be using them, the YMCA can be using them as well. But actually make tools that make it easier for people to deliver the messages, give them the resources to move forward on this. We've got sets of activity plans now that we've done evaluation of the first 3 sets. We're actually pushing forward on developing other sets, and we will be producing more sets as we go along. So the first phase I was talking about had to do with the nutrition facts. Now, Someone talked about the evidence for nutrition facts or nutrition labeling today. I can't remember who it was, but certainly that was when we were preparing to go in this direction. We were very, that there was evidence out there showing that people understanding nutrition labeling makes a difference to their health. But there was also a lot of evidence showing that people don't really understand how to use the nutrition facts table to its potential. They look at the different nutrients, and they look at sort of the number of milligrams and stuff, and they sort of look at that. But nobody really knows, well, how many milligrams should I have? So what's a little, what's a lot of the particular nutrient? And they don't use the percent daily value on the other side. So we made that decision about 2.5 years ago now to really make a push in trying to help people to understand about the percent daily value. And we decided to roll this out in a very different way in the sense that, I wasn't going to put forward a campaign. As most of you know, these are very expensive. So I had the choice of either doing one campaign once for lasting about 3 months or actually work in a different way with industry to try and extend a campaign where you could actually have it sustained over a number of years for much less money, actually, as it turns out. So we collaborated with the Food and Consumer Products of Canada to mount this campaign. And it was sort of multifaceted. We had, there were TV commercials, there still are, there's print media. We created tools, we created fact sheets, so sort of a large number of things. We had bloggers. We created sort of mummy bloggers. We brought them in terms of trying to get them to do it. So we've actually made quite a concerted effort across a large number of different channels. We had it out in 20 different magazines. The web advertising, somewhere between 13 and 15 million impressions. These are actually out of date. It's a lot more than this now. The on-pack, and this is something we'd never done before, is actually through working with a total, I think there were about 34 or 35 companies that were part of this, and they contributed their on-pack information. So on the back of some cereal boxes, for instance, you had that whole real estate that had the awareness information that I sign off on. Companies couldn't change that at all. They couldn't even change the tint or the color of it so that they couldn't do sort of a co-brand in the sense that it would imply that we were okay in this particular product or not. It actually went on across product lines as well. So this information was not just on what they consider they're good for you versus the ones that you can have occasionally type of thing. It was across the product line so there was no implied endorsement of these particular products. That was really quite cool. As well as the companies, we were involved with a number of other partners, Dietitians of Canada being one of them. And you see the new cookbook that came out last year had this information in it. And a lot of proactive media. There's all sorts of stuff going on. I think one of the important things is that we did come up with a very simple rule of thumb for what is a little and what is a lot. So that, even if you are using the percent daily value, it's meaningless if you don't know what's a little and what's a lot. So basically, the rule of thumb is, 5% or less is a little, and 15% or more is a lot. And that actually lines up quite well with the regulations for making claims as well from the food regulatory side. So that's so did it make a difference? Certainly, we did a baseline study. We just repeated that in August and into the beginning of September. We saw about an increase of about 5%, which is not bad when you're talking about a Canadian population. And we also saw a difference between behavior in whether or not people said that they were aware of our campaign or not. And so what you see in the light green ones are the ones that have identified as saying that they're aware of our campaign, and you see that their behavior is different than the ones who are not aware of our campaign. And this is about use of the nutrition facts table and interpreting it, thank you, going forward. Now, I don't want to misrepresent this as cause and effect, right? This is just going out and saying, okay, do you recognize this, and what is your behavior? So it could be that the people that tend to use the nutrition facts table recognize the campaign too. So I don't want to overstretch what's there, but it is a nice indicator that it could be reflecting that we're having results. We are going to, of course, try and interpret that much further. So the percent daily value campaign, based on these initial results, we're continuing this for another year with the companies, and we're starting to look as well at what is the next component around the nutrition facts table that we should be focusing on. We've done percent DV. I mean, that we'll always have to bring this forward because that's sort of a real basis of information that's available for the food supply. And what we're, of course, talking about is now the amount of food and how you line that up with portion size, plate size, I guess, is what we saw as well. But sort of that whole thing about amount of food, portion size, to help people to interpret that type of information. So that's where we'll be going off in the future, and we haven't. There will be a call for proposals sometime, probably in the spring. Sometime we're just developing that right now, but certainly we see that has been a very good initiative, and we do plan to go forward with that as well. The sodium reduction side, this is something that we have just released in a more fulsome way, but almost a year ago now we actually released the National Sodium Reduction Messages and Tips, and this is something, again, that we did in very close collaboration with Dietitians of Canada, BC, and Eat Right Ontario. And through this, I think, I don't know if any of you dietitians were involved in the development of the messages. There was a lot of testing here in Toronto and in Ottawa and in Montreal. We did it sort of across the country in lower socioeconomic, higher socioeconomic, and we did it in Punjabi communities. We did it in Chinese out in Vancouver as well. So we tested it in a lot of different places. So what we have is a set of messages. There are four sorts of themes, or it talks here about four key facts. But the four areas where we have developed messages have to do that sodium is in salt, so it sort of identifies where you're getting your source of sodium. The second set of messages has to do with that we as Canadians are eating too much sodium. Third one is that it affects our health. And fourthly is that most of the foods we eat contain too much sodium. So we've developed messages that have been tested in different, as I mentioned, different communities, different socioeconomic groups as well, that can be used with those sort of 4 sets of areas. As well, we develop tips on choosing lower sodium foods when you're in different environments, whether you're preparing foods at home, whether you're shopping in a grocery store situation, or whether you're out at a restaurant as well. So we've got those tips. So it's kind of neat. The idea is that we have got these messages, we've developed them with provinces and territories and one health professional organization, and what we're hoping is that other organizations will be adopting them. So we've got, Hypertension Canada has actually done a complete review of all of their materials, and they've incorporated these messages so that when they go out, the messages they're putting out are consistent with the messages put out by the provinces, by the territories, and by Dietitians of Canada. So there's that consistency of message again, so that we're building on each other. And then we've done a number of things with that as well. The media partnerships that I talked about, we have used those messages then as the basis for some partnerships that we've put together with media. This is an example of Chorus, which was one of where we both have it both on their TV channels, a number of different channels where this is running. Or I don't know, did any of you see any of this, the Wilsons, in the last month? Any hands? Anyone see it? Oh, not all that many. So they produced all these different vignettes and ran it on Chorus. As well, they've got a microsite, a website where there are challenges and so on. And this will be building on continuously. We release this for sort of the back-to-school time environment. We did it. We have another media partnership with ASTRAL, and this is in French, a similar sort of an approach. We also, with Transcontinental, that's more of a print plus a digital environment there. So Canadian Living, how many of you saw the article on sodium in Canadian Living in October's thing? Okay, so several of you. So that was, our messages are in that article. So everything that's in that article has actually passed what we developed with provinces, territories, Dietitians of Canada, and are being incorporated with other health professionals as well. So again, the consistency. Now, it doesn't say in there that this is a Health Canada advertising, because that's not what we're doing. We're trying to change the environment, and they get it from different areas. So they will be coming out with articles every month now going forward that are nutrition-based, and they are based on our messages that we've been developing and consistent with the guidance of the food guide. And the same for what's going on with Chorus and with ASTRAL as well. The television ones, there are 4 time periods where they'll be coming out. So we had, as I mentioned, we released the back to school. We're going to be doing around the holiday period. We'll be doing around Nutrition Month, and we're going to align the messages in Nutrition Month with what Dietitians of Canada's theme is on Nutrition Month with shopping skills. And then sort of the 4th time every year that we'll be doing this is sort of at the end of the school year as you're going into the summertime. So the idea is to come back 4 times a year with messages that are consistent across all these different sort of outlets. So that's the idea. Retail partnerships I mentioned. Well, we have, thank you. With retail partnerships, we've been working with the Retail Council of Canada, who, of course, is the association where you've got Loblaw, you've got Walmart, you've got Sobeys, you've got Metro, you've got Safeway, there are a few others as well. And while we have not signed on that particular one, we are just about there in terms of an agreement, and they will be part of the rollout in March with respect to shopping skills. So the idea is that so you'll be getting it in the media, you'll be getting it through our messages, you'll be getting it through the provinces and territories, you'll be getting it at the point of purchase as well. And the rollout there will depend on, from Sobeys to Loblaw, how they want to approach it. It might be about nutritionists doing tours in the store. It might be about something that they publish in their things that they send out or on their website. So they might be implemented differently, but the idea is that they're consistent with the messages that we're developing. They've agreed to that, and with our timing as well, so we can coordinate what's coming out from these different places. Our website we have updated just recently. This is the Healthy Canadians website. So Healthy Canadians is for consumers. Right, so the idea here is that the messages you find in Healthy Canadians is for the consumer. We've also updated our Health Canada website. So the Health Canada website here is for intermediaries. And what we have on the Health Canada website is called a Health Eating Toolbox, where there should be materials that will helpful, whether they are PowerPoint presentations, if you're going to be talking about healthy eating, and what we've done right now has to do with sodium reduction. It can be with press releases. They can be notices that you might want to. PSAs are available there. And we're fine completely with co-branding and all of that. If you use our material, there's places there to plop whatever your logo is on it as well. If you stay true to our messages, I don't care about co-branding. I'm controlling the messages, obviously. NGOs, we're working with NGOs, Heart and Stroke. We're the Health Eating Calendar that is going to be distributed in about 2 weeks' time, I guess it is, for next year. We've got messages in there as well. As an example, we're trying to develop more with other NGOs as well and with other associations, health professional associations. The third phase, which will be which we tend to put out, we hope to put out starting in the springtime, has to do about healthy weights. Now, what we're doing with healthy weights is we're going to take an approach where it's not about nagging at people, about not eating the right things, about doing more physical activity. We're actually going to look at the behavior change that we want to see and be more of a positive type of a campaign and concentrate on food skills to really increase literacy, to increase their ability to prepare foods, to increase their, actually in the next slide here, the sort of different areas of food skills. So there's all that knowledge component, the planning component, the use of leftovers, adjusting recipes, the mechanical techniques that are there, and then the whole food perception area. So it's quite a broad area. We are trying to figure out how do we go through that in the years to come. And so as we go through that, we will as well be working that material back into our Eat Well, Be Active toolkit so that you actually have lesson plans to sort of march through those things. So that's the area we're going with respect to healthy weights. We're doing our baseline data through CCHS starting in November and December. We'll get a sample size of about 10,500 to really, what's the baseline knowledge in a number of areas in food skills. That will also inform us about how we put this together in the years to come as well. We are working again with Dietitians of Canada and BC Ministry of Health on developing basic healthy weights messages as well. Those are actually, we've already got the drafts there. So again, similar type of approach. We work on sets of messages together with different organizations and then hope that other sectors will use these messages as well. So I think, did I make it in time? I did. Yeah, perfect. So that's where we're going. So you see, it's a very different way for government to be working. We're not doing the conventional types of advertising campaigns. We're trying to partner as much as possible. We're trying to make sure that there's consistency of messaging, no matter where that messaging is coming from, the best that we can. Obviously, we're not going to be able to control all nutrition messages in the country. That would be a lovely thing, perhaps, but it's not going to happen. So we are getting going. We've started it. We're on our way. Now, what we want to do, of course, as I mentioned, we want to make. How do we extend that? How do we bring in other partners? How do we bring in other collaborators? And I think that this is where there is potential for not just the Dietitians of Canada to be involved, but for for docs, for primary care, for your specialists as well. How do we make sure that we've got the right type of material, both to educate health professionals and for them to use with their patients as well? And that's where we really are wanting to get input from health professionals as well. What is it you need? What is there in our toolbox that works? What doesn't work? What's missing for you? And we'll try and do our best to do that. So we've got the feed. There's a little bit more information. So I think before I keep talking, I will have used up all the time that I gained. I will open it for questions. Thank you. No questions. Okay. I guess it was just so clear. That's great. Okay, thank you.